Overview of the thyroid gland.
The thyroid gland, brownish-red and highly vascular gland, is placed anteriorly in the lower neck, level with the fifth cervical to the first thoracic vertebrae. It consists of right and left lobes connected by a narrow, median isthmus. The lobes of the thyroid gland are approximately conical. Their ascending apices diverge laterally to the level of the oblique lines on the laminae of the thyroid cartilage, and their bases are level with the fourth or fifth tracheal cartilages. Each lobe is usually 5 cm long, its greatest transverse and anteroposterior extents being 3 cm and 2 cm respectively. The posteromedial aspects of the lobes are attached to the side of the cricoid cartilage by a lateral thyroid ligament. The isthmus connects the lower parts of the two lobes, although occasionally it may be absent. It measures 1.25 cm transversely and vertically, and is usually anterior to the second and third tracheal cartilages, though often higher or sometimes lower because its site and size vary greatly. Pyramidal lobe is often present projecting upward from the left midline of the isthmus and connected to the hyoid bone by levator glandulae thyroidae. Thyroid gland has two capsules. The true capsule, which is the fibrous layer enclosing the gland. The false capsule, which is the pretracheal layer of deep cervical fascia. Thyroid usually weighs 25 gram, but this varies. The gland is slightly heavier in females, and enlarges during menstruation and pregnancy. Estimation of the size of the thyroid gland is clinically important in the evaluation and management of thyroid disorders and can be achieved non-invasively by means of diagnostic ultrasound. No significant difference in thyroid gland volume has been observed between males and females from 8 months to 15 years. Relations. In relations to isthmus. Anteriorly, anterior jugular vein, sternothyroid, sternohyoid muscles, skin, and fascia. Posteriorly, second, third, and fourth tracheal rings. In relation to lobe. Anterolaterally, skin, fascia, sternomastoid, sternohyoid, sternothyroid, and omohyoid. Medially, trachea, esophagus, larynx, pharynx, recurrent laryngeal nerve. Posteriorly, carotid sheath and its contents, parathyroid glands, and sympathetic chain. Blood supply. Arterial. Superior thyroid artery, which is a branch of external carotid artery. Inferior thyroid artery, which is a branch of thyrocervical trunk. Thyroideima artery, which is a branch of arch of aorta. Venous. Superior thyroid veins, which drains into internal jugular vein. Middle thyroid veins, which drains into internal jugular vein. Inferior thyroid vein, which drains into left brachiocephalic vein. Lymphatic drainage. Is mainly to deep cervical lymph nodes and few vessels to paratracheal nodes. Nerve supply. Thyroid gland is innervated by sympathetic plexus reaching the gland around its arteries.